Okay, so these are the muscles for station 2. A lot of them are going to originate on the humerus and insert somewhere down here, either on the radius, the ulnar, the carpals, or even the fingers. First one right over here is what we call the Brachial Radialis. So like the name says, it's going to originate somewhere on the brachium, insert on the radius. So more specifically, it originates on the epicondyle of the humerus, and it inserts on the styloid process of the radius, and therefore it's going to help with flexion at the elbow. The next one, we come over here anteriorly. So this is the Pronator Teres. Like the name says, it's going to pronate the forearm, but it's also going to cause flexion at the elbow. It originates on the, more specifically on the medial epicondyle of the humerus, and also on the coronoid process of the ulna, and it will insert on the lateral surface of the radius. So again, the Pronator Teres. The next one is the Flexor Carpi Radialis, which is this long muscle over here. So like the name says, it's going to flex. So Flexor Carpi Radialis. It's going to insert on the carpals, more specifically at the base of the metacarpal 2 and 3. But it's a little bit tricky because it says radialis, but it's actually going to originate on the medial epicondyle of the humerus. Radialis because it's going towards the radius. Okay. Next one is the Palmaris Longus, which is this long muscle right over here. And the Palmaris Longus is going to help the flexion with flexion at the wrist, so together with the Flexor Carpi Radialis, and the next muscle that we're going to talk about, which is the Flexor Carpi Ulnaris, the Palmaris Longus is going to help with flexion at the wrist. So it's going to originate on the medial epicondyle of the humerus, and it's going to insert on the Flexor Retinaculum right over here, and you can see the tendon coming right over here. So while we're here, this is what we call the Flexor Retinaculum of the hand, and what it is just a big wide band of connective tissue that will hold up the tendons of the flexor muscles. So that's exactly what it's doing right over here. The next one is the Flexor Carpi Ulnaris. So it's on the medial side, close to the ulna. And what it's going to do, it's cause flexion and adduction at the wrist. So it's going to move it closer to the body when you flex it. And it's going to originate on the medial epicondyle of the humerus and also on the olecranon of the ulna. And it's going to insert in the pisiform, the hamate, and the base of metacarpal 5. The next one, we're coming over here posteriorly. Oh, actually, no. The next one is right over here anteriorly also, which is this one right over here underneath. This one is the Flexor Digitorum Superficialis. So you can see right over here. And it's called Superficialis because it starts underneath. So if we remove these, you can see where it starts right over here. Okay, so Flexor Digitorum Superficialis. So it starts over here, you can see it there, and you can also see it here underneath these muscles. And this muscle is going to originate on the medial epicondyle of the humerus, also on the coronoid process of ulna and radius, and it's going to insert on the bases of the middle phalanges through 2 through 5. And what it's going to do, like the name says, it's going to flex at the proximal interphalangeal and metacarpal phalangeal and at the wrist joints. So basically it's going to flex your wrist. Next one is this muscle right over here. This one is the Flexor Pollicis Longus. So like the name says, it's going to flex the pollex, which is your thumb. And it's going to originate on the radius and on the interosseous membrane, which is the membrane between the radius and the ulna, and it's going to insert on the base of the distal phalanx of the pollicis because it's called Flexor Palmaris Longus.